Hello, this is Dr. Joseph Aiello again from San Diego Center for Integrative Medicine with more information on our Ideal Protein Weight Loss Program. We love this program. Not only is it a weight loss program, but it is also a natural treatment for many of the issues plaguing America today. It can reverse the effects of metabolic syndrome, lower cholesterol, and obviously help diabetics. In fact, we have gotten many patients off of diabetes, blood pressure, and cholesterol medicines. We are pleased to present this educational seminar. Juliana, our nutritionist, has researched for 7 months to find the best weight loss program she could, and I'm sure that after you see this educational seminar, you will agree that she has found it. So, let's get started with some statistics. 2 out of 3 adults are overweight, and now 1 out of 3 children are overweight. And unfortunately, overweight people cost more in healthcare dollars, as you can see on this slide. What are we talking about with metabolic syndrome? It is a combination of abdominal obesity, high blood sugar, high blood pressure, and low HDL with high triglycerides. Why is this important? Because people with metabolic syndrome have more predisposition to diabetes and cardiovascular disease. This is why it is critical to reverse the metabolic syndrome and why we are excited for the Ideal Protein diet regimen. So what is the culprit? Too many carbohydrates. People just eat too much carbs. This is in starches and in sweets and in sugars. The main culprit of the carbs are starches, refined sugars, and sweets. And these can be in candy, in cakes, donuts, sweet drinks, rice, potatoes, pasta, cereal, many of the white-looking foods that are starchy. Not convinced sugar is an issue? Look at this slide. In 1905, Americans only consumed 5 pounds of sugar per person per year. So what do you think it is now at this time? 150 to 200 pounds per person per year. Ouch. Now you can see why when I say that people eat too much carbs, it is blatantly obvious. What is at the center of the problem? It is the dysmetabolic syndrome X, or metabolic syndrome for short. This is the epidemic of the century. It has to do with abnormally high levels of insulin in the blood. The abdominal obesity, high cholesterol, high blood pressure, and high blood sugar are all symptoms of metabolic syndrome. We must treat the underlying cause to treat the above. They cannot be treated effectively when treated individually by themselves. Excess insulin is the underlying cause, and excessive carbohydrate consumption is the inciting factor. How did we get here and where are we going? Americans consume too much carbs in the form of starches and sweets and sugar. Current children may end up with a lower lifespan than their parents, and 1/3 of U.S. children are expected to get diabetes. And I have seen this in my practice. What happened? It has to do with how we process sugar, insulin, and store fat. When we eat simple carbohydrates such as starch and sugar, it causes our pancreas to produce a lot of insulin. Insulin is a storage hormone, and all excess calories get stored as fat. Basically, the body is storing up for a famine, but in today's U.S. society, the famine never occurs. It has to do with bad food combinations and the lack of exercise. Fortunately, by the end of Phase 4 on the Ideal Protein program, you will learn appropriate food combinations to keep your weight off, and exercise is a very minor part of weight loss. So, insulin is a culprit because in the process of lowering your blood sugar when you consume a lot of sugar and carbs, it also causes storage of extra calories as fat. What we are trying to do in the Ideal Protein program is to have your body preferentially burn fat for its calorie needs. Your body has 3 sources of energy: glucose, muscle, and fats. With the Ideal Protein program, we want your body to burn only fat and spare muscle mass to maintain your metabolic rate. This is another reason why we're very excited about the Ideal Protein diet at San Diego Center for Integrative Medicine. This is because other programs cause you to lose water, fat, and muscle mass. This makes it harder to maintain your weight loss when you are off the diet and is a big reason for weight loss, weight gain, and the yo-yo dieting. This is what happens in a typical low-calorie balanced diet. Ideal protein is different because it maintains protein consumption and decreases fat and carb intake. This allows the pancreas to rest and stop producing so much insulin. This then stops the body from storing excess calories in fat and allows the release of fat to provide the needed daily calories. This is the ideal protein method and why we are very excited about the possibilities to help people not only lose weight but also resolve significant medical issues. I am happy to present this educational seminar to you. I hope you learned more about how your body functions, and if you wish, please call our office for a consultation. We not only offer ideal protein, but we also do hormone balancing and regenerative medicine. Thank you.